Hello there, welcome to another episode of Putting Dr. G on the spot in the month of March, and we're approaching the 27th of March. Actually, what's the significance of that day? It is the day when the blue pill was first introduced in 1998. Imagine 26 years down the line, initially all that fear about how this drug can cause havoc in health and also society hasn't really happened, and it actually stood the test of time. Exactly what are the effects of this medication as far as efficacy is concerned? Actually, for 70 to 80% of men who take this pill, the erection can actually be restored. However, what are the side effects, you ask? In fact, curiously, there are a few very unique side effects of this blue pill. First of all, for people who take this, they always get these hot flushes. Why does it happen? It's because of dilation of the vessel. Effectively, this drug is a vasodilator. When it causes the dilations of the vessel, some people will get hot flushes and also headache. And that is probably the commonest side effects somebody can expect. The second issues that the medication can induce is this indigestions. Because it's a vasodilation, it relaxes the smooth muscle, and there is an acid reflux that can induce for somebody, especially if you have got obesity. And lastly, a very curious side effect that is very unusual. It's called the blue and blurred vision. So exactly how it works is that there's a cross reactions of phosphodiesterase 5 and phosphodiesterase 6, and that 6 occur in the retina, and that interactions will cause the difficulty in differentiation between blue and green. As a result of that, the activation of retina actually induces some sort of blue vision, and that itself also causes some sort of blurred vision. Some men who take the pills reckons that the blue pills and the blue materials is gone to the eye, and then a bit of guilty conscience thinks that they're probably going to go blind. However, thank goodness that is not the case. People often ask me, is there an absolute contraindication to the blue pills? Yes, there is. There are two conditions that you're not allowed to take the pill. Number one, if you're on nitrites, GTN for your angina, no. And number two, if you've got a genetic condition called retinitis pigmentosa, then you're not really suitable to take the pills. For next week, we're going to explore the possibility of cure for ED. Of course, you've heard of all sorts of technology that potentially can cure ED. And more interestingly, if you're interested to find out whether the blue pill can cure ED, then stay tuned for Putting Dr. G on the spot next week.